Good afternoon, Christina. Thanks for joining us again on our Pure Health Direct YouTube channel.
Thanks for having me.
Today, we're going to be talking about melatonin. You're going to fill us in on melatonin.
Yes.
What is melatonin?
Well, it's a naturally occurring hormone in the body. It's produced by the pineal gland in the brain, which is pea-sized and in the centre. So it helps with the sleep-wake cycle, and it's also called the circadian rhythm.
Tell me, what is melatonin used for?
Yeah, there's a few conditions that melatonin is recommended for. It's mostly recommended for insomnia, but also for jet lag and just fatigue, malaise, also good for hormonal imbalances as well.
Yeah, it's a bit of a restricted sort of item though, isn't it?
Yeah, well, in many countries it is illegal just to get it over the counter. You do need a prescription, and that includes Australia. So before people can go on to melatonin, they do need to get a script from their healthcare practitioner.
Thank you. Are there any side effects from taking melatonin?
Yeah, well, some of the side effects that you do want to watch for, it is a hormone, so it can have some side effects like any sort of medication can. Some to watch for would be nausea, dizziness, low libido, and depression and nightmares, that sort of thing.
Christina, when is melatonin not recommended to be taken?
Yeah, there's a few things where melatonin is not recommended. If you do have diabetes or if you're an epileptic, it's not recommended to go on melatonin. Also, anyone pregnant or lactating. It has been used in children with some success, but generally not recommended because it can affect some development. It has been shown to affect some development in children, so it's again best to consult your healthcare professional.
Thank you. Is there any potential drug contraindications with melatonin?
Yes, if you're on MAO inhibitors, warfarin or corticosteroids, you can't use melatonin.
Now tell me, there's a couple of different types of melatonin. There's just the sublingual melatonin, and there's also the straight melatonin you get in the capsule.
Yes.
What's actually the difference in the two forms?
Okay, so there's two different forms. As far as effectiveness goes, the sublingual lozenge is the best because there are a lot of blood vessels under your tongue. So when you do the sublingual, it's going directly into the bloodstream. It's going to work very quickly. But some people with allergies will prefer a capsule form because there's no binders or fillers. There's nothing except the melatonin and the capsule. So for some people, that's a good option. It just depends. So sublingual is faster, but for some people, they do need that hypoallergenic form.
So with capsule versus sublingual, you need a stronger dosage of capsules?
Well, yeah, that's a good question. Well, as far as the capsule goes, it is going to be released slower. So a doctor or someone would probably recommend a slightly higher dosage. But again, when you're playing around with dosages, you do need to check with a professional when it comes to melatonin.
What is the melatonin dosage needed for sleeping?
The recommended dosage is 0.5 to 3 milligrams, and you take that about 15 minutes before going to bed. But 3 milligram approximately is the average dosage that's recommended.
Are there any tips for promoting a healthy circadian rhythm?
Yes, because in a lot of people you've gotten out of the funk of your sleep-wake cycle, and for melatonin production it needs to be completely dark. So if you do have low melatonin levels, some things that you can do to help with that is to actually get rid of any light in your bedroom at night. So sometimes it's good to get block-out curtains or blinds. If you do have a clock radio and that's shining on your face, it's good to get rid of that as well. So a good judge as to whether or not it's dark enough is actually to hold your hand up in front of your face, and you shouldn't be able to see your fingers. And that can actually help increase melatonin levels naturally.
Right.